Whew, okay. Right.
For those of you who just log in, we're going to give it a couple more minutes and give everyone else some time to log in. Okay, I would like to welcome everyone and thank you for joining us this evening. I know the weather is a nice summer night and you chose to join us. That's fantastic. I would like to introduce myself. I am Lori Garcia. I am the program manager for the dental assistant. Also joining us this evening is Kim. She is our externship coordinator. And one of our instructors, Jerry. I think Dr. Chen will be joining us a little later, but she is also one of our instructors. So tonight, I just want to, our main goal for this evening is that we provide any and all answers to your questions regarding the program. So we'll go over, eligibility, a brief discussion about the curriculum, just maybe some overview, and Jerry will go over that. We're also gonna talk about some financial options, some payment options. We'll go over about the externship and what to do after this evening. So I want to just remind everybody before we get going here, we are recording this session mainly because for those who are unable to attend, we want to be able to share them the information. As for just for bandwidth issues, we've learned that if you turn off your video and your audio, it'll help with not cutting in and out and all that. Also during the presentation, if any questions that you have, please do not hesitate to post your questions in the chat box. Between Jerry and Kim and I, we will answer you there. Or the other option too is after this evening, if you have additional question and you need to clarify something, please do not hesitate to send an email to healthcare@cod.edu. Again, that email address is healthcare@cod.edu. So just a brief overview of what a dental assistant is. Dental assistants, their main role, and that you will find yourself, of course, in the dental field, in the dentistry field, you will be assisting your dentists, setting up an equipment that they need. You will help prepare patients for treatments and, of course, keeping records and files. As far as salary, most recent info that we have is from May of 2019. That's from the Bureau of Labor and Statistics. The annual wage is at $40,270. The anticipated job growth. Again, the most recent info that we have is that it has grown 3.6% over the last 2 years and is expected to grow by 13%. This profession is expected to grow faster than any average tech careers. Fall 2020, which is the upcoming, we will go over a little bit more in detail here because it's a change, of course, due to the pandemic. Normally, this program is, delivered face-to-face, and of course, with the pandemic, we had to make some changes. So let's go over with how we're going to do that. The class will start September 8th through December 17th. The class meets on Tuesdays, Thursdays, and Saturdays. Saturdays are our lab days. So what we will do with the hybrid is that on Tuesdays and Thursdays, 5 to 9 p.m. in the evening, we will meet online. And Jerry will be facilitating that. So from the whole semester, Tuesdays and Thursdays meet online. And Saturdays, again, for your lab days, which starts September 12th through October 31st from 9 a.m. to 1 p.m., we will meet on campus at the Health and Science Center building at the Dental Hygiene Clinic, which is room 1122. So that is how we are going to be delivering the program this fall. Pardon me, I skip a slide there. Again, due to the pandemic, there are some changes on the program. We will be following the CDC guidelines in regards to physical distancing. The college, of course, have developed procedures on how we are going to do that, but the details on that you can find on cod.edu. You will see as far as the protocols and policies, but I will go over, main points here this evening. For example, students will be required to wear masks. And so that means when you are on your lab day on Saturday, you will be wearing masks. And of course, we encourage you to keep your distance. Of course, hand washing. The college have implemented that classrooms are cleaned daily and sanitized daily. When you report on Saturdays on campus, there will be screeners. So you will be asked and they will be taking your temperature. They will be asking you questions. And yes, this will be done every time you report on campus. So please expect that and allow yourself some time to go through that whole process. The campus, as you will see, when you report, there will be some signage as far as which way to go, because there are some buildings and hallways that are not open. So there will be some signage to follow there. I keep going one slide over, so pardon me. Just a quick overview of what you will be needing for your supplies. Pretty much generic, right? Notebook, your journal, safety glasses if you need them, 3-ring binders, highlighters, some index cards, CPR certification. Kim will go over that in a little bit, but that is required because that is required during your externships anyway. some medical scrubs, some jacket, clean tennis shoes, and those are mainly during your lab days, which means on Saturdays. As far as textbook, you will find your required textbook in the college bookstore. You can order them online. You can arrange for curbside pickup. You can go through that and review that through cod.edu. So let's go over a little bit some expectations, specifically during your Saturday class. Now, this is not to say that this isn't expected during your Tuesdays and Thursdays class, right? Please remember that even though the class is going to be online on Tuesdays and Thursdays, attendance is required, and please report on time. We will be taking attendance. And of course, we expect you to be prepared, professionalism is expected. No cell phone use, please. This class is non-credit, but we will be following the college policy when it comes to academic integrity. If you want to go and read on that, you will also find that on cod.edu. So this, as far as what to wear and what not, this is of course again during Saturday because you will be in the lab. So you will be hands-on. So you will be handling equipment and stuff. So we ask, please, have your hair pulled back, no piercing, no cigarette, of course, no smoking, I should say, no strong perfumes. And again, please, if you are wearing nail polish, just keep it nice and light. I touched base on this a little bit. As far as attendance policy, it is a requirement in completing the program. You cannot go over 3 absences, otherwise you'll fail. Your mark has failed. If for any reason something comes up and you found that you're unable to participate this semester, you have up to 2 business days before the start of class to receive 100% refund. We'll go over this in a little bit, but please keep in mind, especially this time, any update and any emergencies, those are all posted on cod.edu/coronavirus. The college is keeping up and trying to make sure any alerts and announcement is posted there. So Blackboard is the platform that we will be using as far as the mode of delivery. Your instructors will be utilizing this as far as, of course, your homework, discussion boards, posting assignments, any announcements, your course syllabus, again, your grading, you will find it there as well. So I want to remind everybody, let's start with how do you get into Blackboard, right? Or how do you start with that process? First, you'll start your account on My Access, which you will be anyway when you register. So you register for the class unless you already have an account with COD, but you register for the class by creating an account through My Access, after which you having a My Access account, this triggers the setup of your Blackboard access, including your due page, including your college email account. I want to remind you that please try and stay on top of your college email, because again, this is how we will be communicating with you. Again, that would be how your instructors will be sending any announcement, including us. Between Kim and I, we will be sending any update using your college email. And this is essentially just going over that again. And as far as any IT assistance, here is your information. If you need any assistance as far as setting up your account, accessing, resetting password, please contact Student Help Desk or email them at studenthelp@dupage.edu. I'm going to take a pause here and see if anyone has any questions at this point. Let's see if we can. I'm going to assume that everybody's okay. I hope I'm not going too fast. And I think, I'm not sure if, I think from here I'm gonna say everyone is, or things are going smooth. And I think I will hand over to Kim and start with our externship process. Kim?
Hi. Okay, I'm Kim. I'm the externship coordinator. You will be working with me alongside your instructors, as I will help you prepare for externship. Externship is required. So one of the first things that we're going to tackle is the resume. A resume is required for externship. That is how I communicate with dental offices that I have a student that is interested in that office for externship. Final resume deadline will be Friday, October 16th, because I have to allow myself and dental offices and you guys time for interviewing, because externship will probably start beginning of November, end of October, beginning of November, okay? I have to accept resumes on the due date or before, but after I cannot. If you don't have a resume and you are interested in some one-on-one resume help, I'm certainly available to do that. We can do it virtually. In order for you to go to externship, you must be passing the dental assisting course with a 75% or higher. If you are not at 75% at the time of placement, you will not be placed. And so moving backwards, the resume, we're gonna have a resume workshop. It will be virtual. It's gonna be Tuesday, October 6th, and it's from 4 to 6 p.m. So we'll be doing it online on Zoom. You can pop in, pop out as needed. There's a short presentation for it, but I urge everyone to attend the resume workshop, because if you don't have a resume, or if you want to spruce up your resume and tailor it more for the program that you're registering for or interested in or that you're in, this is the best way to do it. So I urge everyone to attend the resume workshop, and I will certainly send out reminders closer to the date and the Zoom information as well. Is that it? Do we have another slide? Oh, okay, here it is. So, externship process. So again, we discussed it. Resume deadline, October 16th. Every dental student must be CPR certified, okay? BLS, basic life-saving CPR, everyone has to do this, okay? And you must have that submitted to healthcare@cod.edu by October 20th. If you do not get CPR certified, you cannot proceed to externship. If you don't know where to go to get CPR certified, a quick Google search to see what's in your area. The CPR classes cost, I don't know, anywhere between $40 and $80, but it depends on the facility that you go and take the course at. So I urge everyone to try to get on top of that as soon as possible. Don't wait until closer to the deadline. I don't know how things are with the pandemic, so I urge everyone to try to do it as soon as possible, okay? Provide preferences when prompted to choose. When it is time for us to choose where we think we might want to do our externship, I will give you an externship preference form. And on that form, it will include different dental sites that have agreed to host a dental assisting student. And then you choose the ones you're most interested in, and I will try my best to get you your top choice, okay? Externship sites are subject to change. Sometimes a site will say that they can take a student and then come back and say, you know what, it's really hectic here, or I really don't have anyone to train a student. So at any time, you may see that your top choice is no longer available, but that's okay because we have plenty of sites. You will be placed. Once I get all of the preferences in from every student in the class, then I will start to send out resumes to sites. Make sure on your preference form, and it will state it, there are some offices that need specific things other than your resume and your CPR, okay? There may be some sites that want you to have the hepatitis B shot or series. They may want you to submit a copy of your health history. So that is usually notated on the preference form. So make sure that you don't choose a site that you know you won't be able to provide whatever that they're asking for, okay? Prior to placement, a lot of sites will want to do a phone or an in-person interview or orientation, so be prepared for that. I know we say placement, but sites often do want to interview you first. And again, that can be over the phone, or they may want you to come in. And so when you do go in for an in-person interview, make sure you're wearing a mask and everything, but also make sure that you look the part. You don't want to go with t-shirt and jeans or whatever. You don't have to wear a business suit, but you want to look presentable at your in-person interview. Set up your externship schedule. Once you've been placed, once you and the site have agreed that you are going to do your clinical hours there, set up your externship schedule with them because they don't provide that. You give what you are willing to work, okay? Once you do create that schedule, you send it to us, healthcare@cod.edu, okay? You send me your schedule. When you begin your externship, you will document your hours every day that you work. Every day that you're on site, at the end of your shift, have your preceptor initial and sign just to verify that you actually worked those hours. And at the end of your week, you're going to send that sheet to me until you're finished with all 120 hours, okay? Externship is 120 hours. It's roughly anywhere between 4 to 6 weeks long. It is unpaid, okay? At the end of your externship, all of the paperwork that is required, that is your timesheet, which is your site activity log, your objectives, all of your forms are going to be submitted back to us. That is the only way you can get your certificate of completion, is if we receive all of your paperwork back. Do you have any questions or concerns at this point? Okay. Do you want me to go over the externship policies too?
Sure, go ahead.
Okay, so every student will get a student guideline book. That's like your handbook for externship. I will send that a couple of weeks into the class, okay? Once you set your schedule for externship, that is the schedule that you keep unless there is an emergency. Do not change your schedule. Do not come and go when you want to, okay? Be mindful of confidentiality. You're going to see charts, all types of personal information that stays within the office. You do not bring anything out of the office. You do not discuss anything outside of the office. And you'll probably learn about HIPAA in class, but maintain confidentiality while on externship. Dress code depends on the site. They may give you scrubs. They may just say just nice clean scrubs. Of course, a mask, and the same dress code that you adhere to in class is what you adhere to on externship. No visible tattoos, no piercing other than the ears, no strong smelling perfume, no smelling of cigarette smoke or other smoke. So just maintain a professional demeanor. We will go over the guidelines for men and women in our externship orientation that we will do virtually. It is a short meeting. It will probably be 10 to 15 minutes long, okay? But guys should be clean shaven, women nice and neat, hair pulled back, okay? Transportation, you must make sure that you have proper transportation to and from externship. You must get that squared away as soon as you can. Infection control, with everything going on with the pandemic and everything, dental sites are very, very cautious. Okay, so every site that we place students at this past spring in the middle of the pandemic will probably follow the same protocol. So that is the proper PE, masks, face shields, gloves, everything. Okay. Drugs and alcohol, of course, please don't go to externship under the influence. Be mindful of sexual harassment. That is the quickest way for you to be terminated from the program, okay? Always be professional. Always be professional on site, to your preceptor, to the other dental assistants, the hygienists, and the patients. And at the end of externship, your requirements are that you, again, return all of your paperwork back to me. You must have completed all 120 hours, and then you will receive your certificate. Any questions? Okay, site replacement. Once a placement is given, once you're placed on site, you cannot change to another site unless the site can no longer host you as an extern, okay? Or there's an extenuating circumstance that you cannot get around and that site no longer works for you, okay? And again, sites are subject to change. There may be a site listed on the preference form, but by the time placement happens, they may have to rescind that offer to host an extern. But that is okay. You will ultimately be placed. Okay? All righty. With regard to the externship, you must complete all 120 hours. You cannot successfully complete the program without doing all 120 hours on externship. Normal business hours are 8 a.m. to 7 p.m. Monday through Friday. However, there are some sites that will work Saturdays and even Sundays, but it's very rare, okay? Externship does not take place during class time. So once you finish your didactic or your classroom portion of the course, then you move on to externship. There will be some, I don't know, Jerry, if you still do this, but there are some Blackboard assignments that are required during externship, but it's not like the Tuesday, Thursday, Saturday schedule that you will maintain during the classroom portion.
That is correct.
Okay, great. We ask that everyone is flexible. We ask that everyone is flexible with regard to placement and hours worked. Okay, we do the best that we can to try to get you to the site that you are most interested in, but please be flexible. If you're working or you're in another program or something, make sure that as we start placement, or even at the beginning of class, you let them know that you will anticipate being on externship November, December, and you will have to take time off if there will be some type of conflict with your work schedule and your externship schedule. So it's important that you let your employer know as soon as possible that externship is a requirement and you may have to take time off if that's needed. Let them know as soon as possible, and make arrangements for childcare and transportation the day that you register for the course, okay? If you have any issues with any of those, let us know immediately. Any questions about externship at all?
If
I had a
you have a,
question.
go ahead.
So I actually got offered a job to be a dental assistant and I start pretty soon. Would I be able to do my externship through that dental office?
We've had it done before, but you cannot be paid for your externship. And the
Okay.
hours that you work for your externship have to be separate from your work hours.
Okay, got it. Thanks.
Good for you, though.
Thank
I know,
you.
that's awesome.
If you have a question, please feel free to, go into the chat box or unmute yourself. Okay, let's just go over briefly if anyone needs, some support. Of course, the college has the Center for Access and Accommodations. These are their information. Again, the campus is closed, so there's very limited staff and faculty on campus. So please feel free to email if you need any assistance, and they will make that arrangement. Also, after the program, if you need assistance as far as career services, if you need to, refresh the resume that you used for your externship, feel free to contact career services. They are there. Please utilize them. Sometimes we often forget that there are all this extra help that the college provides. I also want to take a pause here and kind of share, we're talking about career support here. The spring semester students, I want to share that 50% of them were hired by their own externship sites. So I wanted to mention that because that's one of the reasons, of course, during your externship, consider it as essentially your interview process of getting a job after the program. This is the time that you show what you've learned from the class. This is the time again to, that's why Kim had mentioned about, professionalism, how you conduct businesses, how you treat your patients, that extra bedside manner will, take you a long way. So I want to remind you that many of our externship sites do hire our students right out of their externships.
They do. And they're looking for students that are eager, that step up, self-starting. So keep that in mind too.
This just goes over as far as, registration information. Again, the college campus is closed. If you need to talk to somebody, this is the phone number to call. That is 630-942-2208. That number again is 630-942-2208. We'll go over some payment plan here in just a couple minutes. Oh, there you go. So the cost of the program is $29.99. And of course, we understand that that is a little steep. Please remember there are options. Don't make that be your, stopping you from your career. First, this program is WIOA approved. This is for those who recently laid off, lost their job due to the pandemic. You can apply and talk to somebody about eligibility through workforce, through WorkNet. And if you need contact info or assistance in connecting there, please email healthcare@cod.edu and we'll be happy to connect you with somebody there. Another option is the payment plan. You can spread out that tuition into 4 payment. Starting not if you contact and make that arrangement now. As you can see here, the later you wait, the less number of installment you can make. And if you are interested in doing that, please send an email to healthcare@cod.edu and we will be happy to connect you and get the application form over and get that started. I think from here, I want to hand over to Jerry. Again, she is one of your instructors. She is full of information, answers that I cannot give you. And if you have any question, please again, just unmute yourself if you prefer that, or type in your question in the chat box. Jerry, you have anything to add?
Hi, I am Jerry Halligan. Dental assisting is my foundation. I am a dental assistant. I'm a dental hygienist. I hold a master's in science. I hold a master's in business. I have an MBA also. So we go through a whole lot in class, but we focus on dental assisting, and this course will give you the basic foundation of dental assisting. We'll meet 2 nights a week. I am your facilitator or your instructor Tuesday and Thursday nights. They're long nights, but we break it up into different segments. I will be sending the syllabus. As when you register, you'll get a syllabus. And that syllabus is our plenary of what's going on week by week. And don't be overwhelmed with the reading and everything. I'm going to teach you a whole different language of your own that no one will understand but you and the dental community. And when we have our chapter readings and you don't understand it, that's okay. That's okay, because we'll go through the highlights of the chapters that are assigned to you so you do understand. But again, as Miss Lori said, and Kimberly, your attendance is imperative because we grow upon each chapter. I understand as a mother, a teacher, an educator, even a person that things happen and you might have an emergency that arises. Just send me an email. All my contact information and Dr. Chin's contact information will be on your syllabus. But I just wanted to caution you that you're allowed 3 absences, but they cannot be on Saturdays. Not all 3 can be on Saturdays, because that's when you learn the hands-on technique. I can teach you up here, the skill, but the mind and the hands have to work together. So, you cannot miss 3 Saturdays throughout the 8-week didactic portion or book portion and lab portion of the course. Being a basic program, we will teach you the basic fundamentals, but the meat and potatoes of the whole program is when you go on your externship. Okay, so I just want to caution you, don't be overwhelmed, because, like I said, we will grow on this step by step by step by step, okay? In your Zoom, can Does anybody have any dental knowledge? Raise your hand when it'll say reactions on the bottom, and raise your hand if you have any dental experience, or unmute yourself and let me know. All right. During the program also, we're going to get you COVID ready for the workforce. Okay. I need to tell you that this is a bloodborne pathogen profession. I need to tell you that by law. And that's why we're so strict on infection control. With COVID, now we're worried about aerosols too. That's something we were never really worried about in the past, but we are now. So we're going to get you COVID ready too, as we call it. And we're going to get you bloodborne pathogen and COVID ready for the workforce. And those two, spectrums of knowledge are priceless. Okay. I work I work public sector. I'm, coordinator for a dental hygiene program, and I'm, all about student knowledge and everything. I'm all about business. And I have great friends of mine who are, I'm private sector, public, and so if you're into community service work, I have a great friend I can, have come on Zoom with us to be a guest speaker if we need to. I'm also adjunct at UIC College of Dentistry. I teach out there 1 day a week to the dental students. And so we have a lot of resources if working in dentistry, if working side by side with a dentist just is not your thing. Okay? We can talk about working in a university type setting. We can talk about working in a dental clinic in a hospital setting. Okay? We can talk about community work, working with patients of the indigenous population of Chicago, especially, or DuPage, or wherever you live. Okay? We can talk about a community dental sealant program. All right, that some of my friends are on a mobile van going from school base to school base and treating children, in a school setting. Okay, right now we're very restricted on what we can do because of COVID, but hopefully in the future, as time goes on, we'll get back to some type of normalcy or routine of what we're doing, But getting back to the Tuesday and Thursday nights, they're long nights. We'll talk about the chapters a little bit. We'll take a break. I will give you some, scenarios that we'll talk about. One of them, just to give you a sneak peek here, is if you walked into a dental office and you saw the dental assistant came to greet you and she had fire red hair with long fingernails and a devil tattoo on her shoulder and welcomed you into the office, what's your first impression? All right. So those are just different talks that we'll have, and believe me, I have nothing against tattoos. I think they're an excellent art, expression. I appreciate them and everything. But again, we're a healthcare profession and we need to be professional. So, those are things that we got to keep in mind too. Okay. As far as your uniforms and everything, on Tuesday and Thursday night when we meet on Zoom, okay, please be patient because we used to meet face to face and a lot of the things we're going to have to tweak here to get us going. All right. I don't care if you meet me in your jammies at night. That's fine with me. I don't care if you have, 2 kids on each side of you. As long as we learn something, that's fine with me. Okay. But on Saturdays, I need you to come professional with hair up and with scrubs on and clean tennis shoes. I don't care if they're neon color, just keep the neon to a minimum, but they have to just be clean. Okay. And again, no holes, no Crocs with holes or anything like that, just because of the environment we're in currently. All right. And I need you to have a lab jacket. And that lab jacket, I need you to have matching scrubs, and that lab jacket can be any color that you want, but it has to have elastic at the wrists, okay? And has to snap or button up to the top, okay, to the neck. Okay, I don't care if your lab jacket is long or if it's a short jacket type. Should say I don't care if it's a coat or a jacket, or what color it is. But your scrubs just have to be matching scrubs of any color of your choice. All right. As far as jewelry and everything, again, necklaces and everything, if you can tuck it underneath your scrubs, that's fine. Okay. Big diamond rings are not suggested because I don't want you, first of all, for infection control reasons, and I don't want you to snap off your gloves and lose your bracelet, your ring, or anything that, you know, is of value or sentimental to you whatsoever. So please, you know, keep your rings and everything or jewelry to a minimum, you know. What else was I going to mention? Dr. Chin will be your dentist on Saturday. We will not conduct clinic or your lab portion for the first 8 weeks unless there's a dentist in the facility, and that dentist is Dr. Chin. Okay. Lori, do you know if Dr. Tom will be coming back?
No,
No.
he isn't.
Oh, all right.
We have a great question here, Jerry, and I'm not sure what your name is, but he is asking, do you have many students that go on to apply to the dental hygiene program? Would you recommend taking this course? If you plan to apply for the dental hygiene program in the future, I am currently finishing the last of my prerequisites. And I can tell you all in capital, yes. And Jerry, you can piggyback on this, but actually, if for the College of DuPage, if you are applying in the dental hygiene program and you finish the dental assistant program, you get let's say you get an extra point in your application coming from this program. It is because the dental assistant program is very much a conduit, and the curriculum is very much to prepare you into the dental hygiene program. So yes, right, Jerry?
That is correct. Yes. Yeah, it's an excellent question. It's your foundation. Your first year dental hygiene might be a little easier if you take in dental assisting, okay? Because, at least you'll know how many teeth, an adult dentition means, mouth, should have, how many teeth a child should have, okay? What are the 3 different types of dentition? Primary, mixed, and permanent. So those are like I said, that's our language. And you'll go into the dental hygiene program at College of DuPage, a little bit, brighter, and you'd have your chin up in the air a little bit once you apply. Not to say that you're going to know it all, but you'll have, you'll go in there a little smarter. Okay. And again, that point only applies for College of DuPage. It doesn't apply to any other hygienes.
Right.
All right. That's an excellent question. Thank you. Thank you. Okay. Any other questions?
That is what, please feel free to unmute yourself if any, or again, don't hesitate to post it in the chat box.
Yeah. But it's a great profession to be in now. Granted, there's just a lot to COVID and everything, and a lot of preparation that dental offices have made, to make sure that everybody is safe, along with staff, patients, and everything. But it's a great profession right now to be in. The jobs are out there waiting for you, to complete, and the money is out there too at the present time. Right. I need to really investigate that a little further, but so we can talk about that in class, because I never want you to shortchange yourself. You're being educated, you're paying for an education, and I want you to use that to your advantage when you go on your any job interview, or even you complete your externship and they want to hire you. I want you to use that as leverage. Knowledge is power, and I want you to use it as leverage, to get the revenue that you've earned. No one gives us anything in life, we earn it. And if you complete your externship, you've earned, in my opinion, a higher salary than someone that doesn't have knowledge.
Yeah.
The feedback from
I also want to mention one of the things that we change. So as we are in compliance with, the COVID physical distancing, is that we have cut in half the class size. Specifically, of course, when you are in the dental hygiene lab. We only have a maximum of 12 at the moment. Excuse me, we only have a maximum of 12. And right now I know there are already students that are registered. And normally we would be doing more, but we needed to do that in order to follow the physical distancing guidelines. So I wanted to mention that. Jerry mentioned COVID, and I'm like, I don't think I mentioned that. Anyway, one question here says, if we, for some reason, were to step back from phase 4, would classes externship continue as planned? I would say no. If anything changes as far as where we're at, the same thing that we had to do during the spring semester, we have to follow the state guidelines.
Right.
But just as we did in the last semester, the college is monitoring it very closely, and we did work alongside with our externship sites. We had to rearrange dates, and yes, there were delays, but we made it happen. Just as I mentioned earlier, many of our students completed their externship. Yes, there was a delay, but they got a job. So, there's just gonna be some lag time if you must. But if anything changes with our reopening, we must follow the state protocol and guidelines.
Yeah. We finished up all of our coursework, our Zoom, and when you go on externship, we still meet on Zoom, and I keep track of you to see how you're doing, and we go through some discussions and some scenarios too, and we continued on with that, and we just had a blast on Zoom. We continued on with all of that, so you could go to your externship and just focus on your externship.
Yeah.
Okay. If we do unfortunately go back to phase 3, that may happen again. But again, we'll move forward with all of our book work and everything, and just and then you can complete your externship and follow closely with Kimberly to make that happen.
Yeah. If you have a question after this session, please again feel free to send us an email, healthcare@cod.edu. Any questions from here on out, payment plan and anything, that's the best way to get a hold of us.
Yeah, it's a great program. We've had rave reviews from employers and students and everything. I've said dental students come through the program wanting to go to dental school and take this course as a foundation. I've had a lot of international dentists come through, at least 2 each course, come through the program because they're not dentists in the United States, but they are in their homeland. And they take the course just to get the US version or the US knowledge of dentistry. And so that's been a lot of fun too. And how many of you plan or have aspirations on going to dental hygiene?
I think we had Hannah who said she is. Anyone else?
Or really not sure, maybe?
Yeah, probably.
Yeah, well, that's good. good. It's a good foundation for dental hygiene, you know, but our focus is dental assisting. You know, again, you will get them one merit point, you know, applying toward the dental hygiene program. It doesn't mean you're accepted. Okay, I just want to make that clear. It just means that you're just going to, you know, get a point towards your application. All right. Right. But it's a great program. I've been here since we started it. I took last semester off teaching face-to-face on Tuesday and Thursday, but I did catch the Blackboard once, you know, students were going to go on their externship. I was in charge of the Blackboard discussion. So that was fun. But, you know, we usually conduct classes of 20 plus. All right. And with a smaller cohort because of COVID, you know, we'll have a more intimate class time.
Yeah. Okay. I hope that we answered the majority of your questions. Everyone is quiet, so I'm going to think that we are okay. You please feel free, where I'm gonna stay on for a little bit. If anyone has a question here, but we're here. Campus may be closed. We're here, we're working, we're all working remotely. So please feel free to reach out if you need any help for any reason and any questions that you come up with. Don't hesitate to let us know and we'll get you the right answer. Jerry, thank you for joining.
Oh, sure. Sure. I love the course. Like I said, I teach a lot of courses on, you know, different levels and everything. And this by far is my favorite.
Yeah.
So
we get a lot of dental offices actually reaching out to us between Kim and I, asking for any assistance, posting any, you know, job opportunities in their dental offices. So
at least once or twice a week. That's very true.
Right. So you have plenty of opportunities for any job, because dental offices knows the program and they speak highly of it. So they come to us, the most of them, they come to us before they even post anything. So that, and when we do get those, we share them to the students, current students and past students. So.
and I just wanted to, you know, say this. I've worked with Kimberly now for, I don't know how many years now, Kimberly, since you've taken on this position.
Two years.
2 years, that's all?
Yes, 2 years, that's it.
Yeah, and she's phenomenal at, you know, working her magic to put you in sites that is close to your home, or, you know, you're comfortable with, or if you wanted to do a specialty and maybe pediatric dentistry, working with kids, or orthodontics. You know, she works her magic to see if she can make it happen, you know, to accommodate you. So she's wonderful. And Lori has just taken on her position. I worked with several other people in the past, and I got to tell you, she is spot on. She answers those emails immediately. I oftentimes wonder if she ever sleeps.
Me too.
Yeah. And you know, all hours of the night, you know, because my schedule is so crazy. I will email her, you know, late at night, and I get a reply almost immediately. So you're working with a great team here to make sure that your learning experience is superior, not just good, but superior.
Yes.
Thank you,
Jerry. That's very kind.
Thank you so much.
Okay. Well, I think